तो ये हम now first question is for nervous system and muscular system, one liner question for any question, any DNB or NEET PG, FMGE. The first question is peripheral central chemoreceptors respond to increased carbon dioxide. True statements about oligodendrites. They form myelin sheath. Hormone which decrease appetite is leptin. Lactose means thin. Leptin is primarily secreted by white adipose tissue. Leptin counteracts the effects of neuropeptide Y. And anandamide. Ghrelin increases appetite. Orexins are not implicated in sexual behavior. Time duration required to generate an action potential is base. Satiety center is located at ventromedial nucleus of thalamus. Nucleus ambiguous. True about nucleus ambiguous. 9th and 10th nerve arise from it. Serotonin secreting cells in brain is raphe nucleus. Achromatopsia is due to lesion in which area of occipital cortex? Area V4. Band not covered by actin filament is H band. ADH is secreted by supraoptic nucleus. ADH is secreted by supraoptic nucleus. Okay. Now, second is oxytocin is not involved in milk production. Photoreceptors on stimulation releases glutamate. Tract which controls skilled voluntary movement is corticospinal tract. Seen in REM sleep, brain is very active but muscles virtually paralyzed. Insulin increases glucose uptake in skeletal muscles. During denervation of smooth muscles, there is increased sensitivity to chemical mediators. Nerve fiber with slowest conduction velocity is C fibers or C fibers. Nerve fibers more susceptible to local anesthesia. C fibers. RMP of cell is dependent on the permeability of a membrane to potassium being greater to sodium. During repolarization phase of action potential, there is increased probability to potassium. Number of Golgi tendons organs for every 100 muscle fibers are 0 to 10. Hemiplegia is most commonly due to the occlusion of the middle cerebral artery. Prolactin secretion is not increased by dopamine. Ratio cells are inhibitory interneurons found in the matter of spinal cord. Volume receptors are low pressure receptors, provide effect for taste control and mediate vasopressin release. Bruxism is not a feature of REM sleep. Contractile unit of muscle is sacromier. Medial genicular body is related to hearing. Specific gravity of CSF is 1.006 to 1.009. In central transaction of spinal cord, last effect is proprioception. Anchor reflex is S1. Ruffini and organ is associated with sensation of cold. Inverse stretch reflex involves lengthening of muscles. Myoglobin is present in slow fibers. Preganglionic sympathetic and parasympathetic secretes acetylcholine. Circadian rhythm controlled by suprachiasmatic nucleus. Superficial reflex is corneal. Serotonin is secreted by argentaphin cells. Hunger center is located in the lateral hypothalamus. Melatonin is secreted by pineal gland. Fever causes thermoregulatory center to shift to new level. Auditory pathway is mediated by major genicular body. The inverse stretch reflex is due to Golgi tendon. Protein common to smooth and skeletal muscles. Actin and tropomyosin. What is generator potential? Depolarization occurs in graded response to strength of stimulus. Nervous potential of potassium is 90. Resting minute potential of neuron is 90. Which type of corpuscles are Ruffini endings? Corpuscles responsible for pressure sensation. Ventral spinothalamic tract carries pain and temperature. Nerve fibers carrying pain are A delta C fibers. Nucleus for accommodation reflex is indigo fall nucleus. Phosphodiesterase hydrolysis what in the retina? What is phosphodiesterase hydrolysis? What in retina? Myelin sheath is produced by oligodendrocytes. Stimulation for sympathetic neuron growth is nerve factors. Multiplying neurons are seen in hippocampus. Striatal tract mediators are dopamine. Striatum damage affects priming of explicit memory. Retinal cells which secrete acetylcholine are amacrine alpha. Presynaptic facilitation is caused by prolonged opening of calcium channel. Broca's area is present in inferior frontal gyrus. Number of Golgi tendons organs per 100 muscle fibers. Iron which helps in resting membrane potential in neurons is potassium. Synaptic potential can be recorded by microelectrodes. Shivering is controlled by posterior hypothalamus. Posterior part of hypothalamus is converted with regulation of response to smell. Preganglionic neurotransmitter in sympathetic divisions or autonomic nervous system is acetylcholine. Blind spot of Mayer-Yotti is optic disc. Stretch reflex of urinary bladder is integrated at sacral point of spinal cord. ये थोड़ा intention tremors are seen in lesions of cerebellum. Bipolar cells are seen in retina. Setting is mediated by cholinergic mediated sympathetic activity. Unmyelinated nerve fibers are C fibers. Pronator drift test is done for lesion of pyramidal tract. Salt and sour taste is pursued by inotropic receptors. Structurally, the type of neurons that act as sensory neurons are pseudo-unipolar neurons. Membrane potential of hair cell is 60. Typical feature of olfactory sensation is stimulus required is very small. True about type 2 muscle fibers, white, glycolytic, fast contracting. Maximum concentration of sodium channel is at node of forNEET. The action potential of nerve, the overshoot is above isopotential. In myelinated nerve fibers, the refractive period is found by 2500 seconds. What is the impulse rate? 2500 per second. Type 1 glomerulus cells secretes neurotransmitter because of oxygen sensitivity. Potassium channel. Neurotrophins includes nerve growth factors, brain-derived neurotropic factors, and neurotrophin 3 and neurotrophin 4. Motilin receptors, G protein coupled receptor binding motilin, which is an intestinal peptide which causes contraction of gut smooth muscles. Erythromycin is a motilin receptor agonist. Unit of stretch reflex is reflex arc. Dolly's eye reflex is used in unconscious patient, which is stimulated by sustained pressure of veins and organ. Wolverine dilatation is for nerve degeneration. Lost resting membrane potential in smooth muscle is 40 millivolt. CSF sugar is 2/3 blood sugar. Rubrospinal tract influences voluntary activity. Cerebral blood flow is increased by increased pressure of carbon dioxide. Unspecified pain pathway is for psychogenic pain. Action potential in cardiac muscle has how many phases? Excitatory cells in cerebellum or granule cells. Somatostatin in C deficiency causes growth retardation. Destruction of this hypothalamus center leads to anorexia and starvation. Later hypothalamus nucleus. Rapidly adapting capsulated receptor for low frequency vibration in non-high risk are Meissner's corpuscles. Most important stimulus for central chemoreceptor is increased participation of carbon dioxide in blood. Inability to see near objects may result from inability to contract ciliary body. Receptor blocked in myasthenia gravis is acetylcholine receptor. Characteristic pattern seen in bronze square syndrome, contralateral absence of pain sensation. Alpha waves are seen in relaxed state. Prosopagnosia is an inability to recognize faces.